Alberta scientists to test a possible COVID-19 drug. Thomas Likeness in Edmonton, Canada reports.
Good evening, Anna. How are things in Vegas?
It's okay, Thomas. It's doing okay.
Just okay. But you don't have any snow and I do. All right, before I get into my report, I want to send birthday greetings out to that big talent from Hawaii, our EBC correspondent there, Alfred Asenis. Happy birthday, big guy. And I see you didn't let the celebration slow you down any. You managed to post more stories on the website today than I did. Anyway, happy birthday, Alfred, and hope to see you soon. Our big story for today is that clinical trial that was announced by the Alberta government for the anti-malaria drug, hydroxychloroquine. I'll have more on that in a moment. I first of all just want to look at the numbers here in Canada. Numbers-wise, we're at about 25,500 cases, 780 deaths across the country. In my neck of the woods in Alberta here, another one, 81 cases reported in the last 24 hours. We're up to just over 1,746 deaths. But a bit of an observation here when you look at the numbers and all of Canada. You see this huge concentration in central Canada, in Ontario and Quebec. 80% of the cases are in those two provinces. It's almost like two countries, the way this pandemic is playing out in Canada. Hospitalization and infection rates are lower outside of those two provinces. Here in Alberta, of course, we had a little more lead time to get prepared. But also in Alberta, public health officials didn't play around. They got tough very, very quickly. And at least for now, those results are paying off. And something else that is happening here, of course, is, like I said, we're launching that clinical trial. Now, hydroxychloroquine was originally an anti-malarial drug. And they still use it, but mostly for disorders like rheumatoid arthritis. However, laboratory studies have suggested it might be helpful against COVID-19, not a cure. And this is what researchers are looking at here. Not a cure. They're wondering whether that 5-day treatment of the drug could lessen the symptoms for those at highest risk. So an elderly person who might have COPD or something, who's at a high risk of dying from COVID-19, if he was on this 5-day course of treatment, would it lessen the symptoms and perhaps even allow him to manage his disease at home instead of in the hospital? The clinical trial will, they're looking for about 1,600 volunteers right now, and it'll be done by researchers from the University of Calgary and the University of Alberta. Now, our Chief Medical Officer of Health, Dr. Dina Hinshaw, says the province is also expanding testing for COVID-19.
Immediately, we are expanding eligibility for testing to anyone in Alberta who has a fever, cough, shortness of breath, runny nose, or sore throat. If you have any of these COVID-19 symptoms, it is important to remember the critical first step. Stay home if you're sick. Your next step should be to take the AHS online assessment form in order to arrange testing.
So we're going to have a lot more testing, and Hinshaw says that's going to reveal a lot more cases, but she says don't worry about the rising numbers.
I know seeing this increase in numbers may be a concern to some, but it's important to remember that the number of daily confirmed cases as a percent of the tests done every day has remained approximately similar through the past several weeks. When we look at the provincial numbers by the date the swabs were collected, the percentage of tests that have come back positive has been approximately 2% for the past several weeks. This indicates that the rate of infection has remained relatively stable over the last while.
So again, don't worry about the increasing number of cases. They were there all along. We're just revealing them faster. Oh, and one other thing, golfers are going to have to wait. Don't be calling up the golf course trying to get a tee time. In response to an online petition from a bunch of golfers in Calgary, Hinshaw, she says she's not going to open up the golf courses. She says they're not essential That petition says golf courses should be exempted from the public health order because, people can exercise and so on. Well, you can do that in a gym too, but we're not supposed to be crowding together right now. So the health order still stands. Golf courses are closed. That petition, incidentally, only got about 1,600 supporters. 1,600 people in a province of 3.5 million? Pretty small minority there. I wish you all good health. Take care of others. Take care of yourselves. Stay home. Stay safe. And stay tuned to Eagle News for accurate and balanced coverage of the COVID-19 pandemic. In Edmonton, Canada, Thomas I. Likeness, Eagle News. We live in interesting times.